Lymphoma is one of the most common cancers that we see in dogs, and lymphoma is a cancer of the immune system. There's a particular cell called a lymphocyte that can become malignant, and lymphocytes are found all over the body, in the bloodstream, found in the liver and spleen, found in intestines, and most commonly found in your lymph nodes. So we know that there's a genetic basis for the disease. It has been postulated that we can see lymphoma develop after exposure to certain types of chemicals. Some of them were older chemicals, 2,4-D, which was in lawn herbicides, and that was shown to increase the risk of developing lymphoma. But in many cases, we don't know what causes lymphoma. And I tell clients that they shouldn't look back and think of what could they have done differently, what should they have done differently. It's a disease that we see happen frequently, and there's nothing that they could have done differently. In our canine patients, we can evaluate 16 different types of lymphoma, and there are possibly more types of lymphoma that we don't know about at this point in time. However, the most common type of lymphoma that we're going to see is a lymphoma that involves the lymph nodes and is considered to be a large cell form of lymphoma, or one that is rapidly growing. We can sometimes see other types of lymphoma that are more indolent. That means that they're slower to grow and may not require the same aggressive treatments. And we may see lymphoma that involves other organs, such as the liver, the spleen, or the intestines. Those types of lymphomas also have a different prognosis and have different treatment plans. Since 80% of our dogs come in with the type of lymphoma that's considered to be large cell and involves the lymph nodes, the discussion that we're going to have is going to focus on this form of lymphoma. If there are differences in your pet's lymphoma, your clinician will be able to explain them because each is a case-by-case situation. So for the majority of our dogs, lymphoma is a disease that involves lymph nodes. And most of our dogs present with big lymph nodes on the outside, and in many cases, they're still feeling good, or they may have minor side effects such as difficulty swallowing, noisy breathing, or not eating as well and being more lethargic. If the lymphoma involves lymph nodes, the most common way to make a diagnosis is through what we call cytology. That's where we put a needle in the lymph node, take some cells out, put them on a slide, and send them off to the clinical pathologist. It is easy to diagnose most forms of lymphoma through cytology. In some cases, if lymphoma involves other areas of the body, such as the intestinal tract, we may need to get a biopsy of a particular organ in order to make the diagnosis. But for the majority of our dogs, we make the diagnosis based on cytology alone. For dogs that have lymphoma that involve the lymph nodes, there are typically 5 different stages. One is if it involves just a single lymph node, and 2 if it involves a set of lymph nodes. No dog is almost ever a 1 or a 2. That's not the nature of this disease. 3 is when dogs have lymph nodes that are enlarged in the front and the back half of their body, and most of our dogs are going to come in at a stage 3. The stage 4 is when there is liver and spleen involvement, which is something that we judge based on x-rays and ultrasound. The most common presentation for our dogs is stage 3 and 4, so that's what I consider to be your average dog with lymphoma. Stage 5 is when there's lymphoma in the bone marrow, which tends to be relatively uncommon, but it definitely affects the prognosis if they have bone marrow involvement. For most dogs with lymphoma, we will do a series of tests that allows us to assess their overall health as well as to see where the cancer is in their body. We need a diagnosis, whether that's through a biopsy or through a cytology. We usually will do screening blood work that includes a CBC, a chemistry profile, and a urinalysis. This allows us to assess the patient for their overall health, as well as to see if there are specific signs that suggest that the lymphoma is having a metabolic effect on their body. We often will do chest x-rays to look for evidence of lymph nodes enlarged in the chest, and we'll often do an abdominal ultrasound so that we can look for liver and spleen involvement. One of the questions usually is how much of this testing do we need to do? And in general, we need a diagnosis, we need a CBC, a chemistry profile, and a urinalysis, and we're still able to treat our dogs. The rest of the information often gives us information about the prognosis, how the dog is going to do with lymphoma, but does not change the treatment plan. The one other test that we do like to do is to look at what we call the subtype of the lymphoma, which is called immunophenotype. And basically, we take a sample from a lymph node, we process it a little bit differently, and it can give us an idea of the subtype of lymphoma. There are two subtypes. There's B-cell lymphomas and T-cell lymphomas. We usually consider B-cell lymphomas to be better and T-cell lymphomas to be tougher to treat. Again, that may not change how we treat them, but does give us more information about the prognosis. For most cancers, we will look at a set of factors that determines whether a patient is going to have a favorable response to treatment or if the patient may not do as well as average. And for lymphoma, there's several factors that we will look at. The first of it being the stage of the lymphoma. As I had mentioned earlier, that if dogs have bone marrow involvement, that those are dogs that are not as likely to respond to chemotherapy or may not respond as long. Those are dogs with stage 5 disease. We will also look at whether a dog is clinically ill from their lymphoma. Dogs that come in that just have big lymph nodes on the outside and are feeling well are going to have a better prognosis than dogs that are sick and have vomiting or diarrhea or difficulty breathing or may need to be hospitalized. That would be what we call the substage of lymphoma. Are you sick from your disease or not? The other important things that we'll look at is the immunophenotype or the subtype of lymphoma. B-cell lymphomas are more common and also respond better to chemotherapy. T-cell lymphomas are tougher to treat and do not respond as well. And then some of it is for those lymphomas that occur in different locations, such as the intestinal tract, primarily the liver or spleen, the prognosis for those dogs can be very different. This is something that we would assess on a case-by-case basis and be able to give you more information about those particular sites and what treatment options are available and how your patient may do. There are several options that we have for the treatment of lymphoma. One of the things that I think you need to remember is that lymphoma is a cancer that can double very rapidly. Lymph nodes can double in 4 or 5 days, which means that without any treatment, most of our patients will only have a month before they succumb to the effects of the disease. We can look at using something as simple as prednisone, which is a steroid. It is considered to be a chemotherapy drug of sorts for lymphoma. It can shrink lymph nodes and it can also make dogs feel better. But the effects of prednisone are short lived, and most dogs will have 1 to 3 months with prednisone. So they will have a little longer time and a better quality of life, but the cancer quickly becomes resistant to the prednisone. We also like to, if we are going to do prednisone alone, make that decision up front, because if they're started on prednisone first and then they start to fail prednisone and we try to use chemotherapy, it may not be effective. The mainstay of treatment for lymphoma is systemic chemotherapy, and there are a number of different options that are available. If you're looking for what we consider to be the standard of care for treatment of lymphoma, it's what is called a CHOP protocol. That's a cocktail of 4 or 5 different drugs that are given over time. And that with this type of therapy, we usually will say about 80 to 90% of our average dogs with lymphoma, that is B-cell lymphoma without bone marrow involvement and feeling well, they will go into remission, and that remission will last for about 9 to 12 months from the start of treatment. The protocol itself can vary between different oncologists, but in general, there are 4 or 5 different drugs that are used. Prednisone is still one of them. There's also a drug called vincristine, which is given as a quick IV, a drug called Cytoxan, which is given as an oral chemotherapy drug, a drug called doxorubicin, which is a little longer intravenous treatment, and a drug called L-asparaginase. Of course, we can't give all of these drugs at once, as that would be overwhelming for our patients. So generally, the schedule starts out as being weekly in the beginning and then goes to a biweekly schedule. Most of the protocols that are used are somewhere between 16 to 25 weeks, depending upon the preference of the oncologist. There are other chemotherapy drugs that can be used as single agents if we don't want to do a more aggressive protocol. For example, we can use one of the drugs that I had mentioned before called doxorubicin, and it's given intravenously once every 3 weeks as an outpatient. And with that protocol, about 60% of the dogs will go in remission, and 6 months is average. We can use a single oral drug called CCNU that is also given once every 3 weeks. And with that drug, we usually think about 20 to 40% of dogs will go in remission, and 4 months is average. So with the single agent protocols, it's better than prednisone alone, but it's not as good as a CHOP protocol. But I always stress to owners that it's one size does not fit all, so that there are many things that go into making a decision about what type of treatment that you would use, your pet's age, your pet's health, what you're able to do in terms of time commitment. So there's no one treatment, and people should never feel that there's a right or wrong decision that they need to make when it comes to the treatment of lymphoma. As long as we have your pet's quality of life first and foremost in mind, we can't make a wrong decision. There are some therapies that have come up on the market recently. There's a targeted therapy called Laverdia that's given orally, although how to use it in lymphoma has not been well defined at this point in time. One of the main things that we stress when it comes to chemotherapy and the treatment of lymphoma is that our patients have a good quality of life during the course of treatment as well as after. So we don't want them to have significant side effects associated with treatment. Yeah, usually we'll tell clients that there's about a 5 to 10% risk of serious side effects. Those are side effects where they may need to come in for a recheck earlier, or they may need to be hospitalized, or they may need additional supportive care at home. But the majority of our dogs experience few, if any, side effects. The most common side effects that we can see with the drugs for lymphoma are gastrointestinal upset, nausea, vomiting, and diarrhea. Those side effects are usually self-limiting, and they occur 2 to 5 days after a treatment, and they will often last a day or two, and the dogs are fine without us doing anything more. If there's more severe issues with vomiting or diarrhea, then we may recommend that a patient be hospitalized for intravenous fluids and supportive care. But overall, gastrointestinal side effects tend to be mild and self-limiting, and we often will send patients home with medications that can be used for nausea and vomiting and for diarrhea so that clients have something on hand to help before the problem gets worse. We can also see a drop in the white blood cell count because chemotherapy kills rapidly dividing cells, and those are cells in your bone marrow. Usually, for most of the drugs, it occurs about 5 to 7 days after treatment. Most of our patients will never know that their white count gets low, but if it gets too low, they can be more susceptible to infections. And these are infections that can come from bacteria that are already within their body or in their environment. So I don't restrict their activities because that's not where the infections come from. If a dog gets an infection, they can run a fever of 104 or 105, and they don't feel good. They would look like we would with the flu, and they generally need to be hospitalized for 1 to 2 days for intravenous antibiotics and fluids. For many of our dogs, they don't know that their white count has gotten low, and the body's own mechanisms will bring the white count up to a normal level, usually within 2 to 3 days. If we have a patient that has a particularly low white count, we may recommend starting them on antibiotics as a precaution against infection, but the risk of secondary infections in our patients is much lower than it is in humans. There are certain side effects that we can see that are specific to certain drugs. One of the drugs that is the mainstay of treatment is a drug called Cytoxan or cyclophosphamide. This is a drug that rarely can cause irritation of the bladder. As the drug is metabolized, it becomes a chemical, and the chemical sits in the bladder, and it can irritate the bladder lining. If this were to happen, it would look like a urinary tract infection, straining to urinate, blood in the urine, or small frequent urinations. The problem is it's a chemical inflammation of the bladder, so it's a time factor for those signs to resolve. We always would recommend that a patient have a urinalysis and a culture done just to rule out that there's not a secondary infection that's causing those signs. One of the best drugs that we have for lymphoma is one called doxorubicin. But this drug can cause side effects in heart function if you give more than a specific number of treatments. We try to keep the treatments in the safe range, and most of our dogs are receiving 4 treatments initially, but they can receive up to a total of 6 treatments. Beyond that, we have to make a decision about the benefit and risk of continuing to use the drug, as it can cause changes in heart function. Some of our dogs can experience hair loss when they're receiving chemotherapy, although it tends to be restricted to certain breeds. Most of our dogs will maintain their normal hair coats. In some cases, they can get a little bit thinner or a little bit more coarse. Dogs that have hair, those types of dogs that need to go to the groomer on a regular basis, may wind up losing more hair. But this part is just cosmetic, and it will return once they have finished chemotherapy. The one other side effect that we can see is that certain drugs can sometimes irritate the skin if they are gotten outside of the blood vessel when we are giving them. And that's why we take special care when we're giving chemotherapy to make sure that we have a catheter well placed in the vein and that we are giving the drug directly into the vein and nothing is leaking out. If you were to have a problem with drug leaking out of the vein, you may see redness and the dog would start licking at the area where the chemotherapy had been given. This would be a situation where we would tell you to call your veterinarian. And as always, the veterinary team is there to be able to help you through any of the side effects that you may see or any of the concerns that you may have when you're going through the treatment process. You're not alone in all of this. You have us to help guide you through this. The goal of treatment of lymphoma is for your dog to be able to go out and be a dog. I do not recommend or feel that they need to be restricted from going to other places. They can be around other pets. They can do their normal activities. I had a dog that took up sheep herding while they were going through chemotherapy for lymphoma. So I feel that they can go about doing their normal activities. If your pet isn't feeling well, we do recommend that you limit their activities until they're starting to feel better. They can be around other pets. They can go to play groups. They can go to the park because that's part of being a dog. And if we had to keep them in a box the whole time to prevent them from getting infections or to keep them safe, then that wouldn't be the life that we would want for them. The goal of treatment is really to improve and maintain their quality of life and let them be a dog. We normally consider lymphoma to be a treatable disease, but not a curable disease. With something like a CHOP protocol, we find that 85 to 90% of our dogs will go in remission, and that first remission will last for 9 to 12 months. However, at some point, most dogs will come out of remission, or we may also find that initial treatments aren't working the way that they should be. We do have several other drug options that we can consider using for our patients, and in some cases, we can get a second or even a third remission for them, depending upon how they're doing. Second remissions are usually shorter than first remissions and can be more difficult to get, but they can be worthwhile, and some of our patients will have a 1.5 year lifespan between a first and a second remission. We would evaluate your pet's treatment history and how they did with treatment in order to make recommendations for what would be best for your pet if they need additional chemotherapy. One of the common struggles that our clients have is trying to make the right decision for treatment. There's no one size that fits all, and you have to take into account a number of factors, including your pet's age, your pet's overall health, other medical conditions, as well as the family's lifestyle, so that there is not a right or a wrong decision when it comes to lymphoma. The most important thing is that your pet has a good quality of life, and when that no longer is possible, that we make the best decision for them at that time. Everybody's different in how they make decisions, and one client may make a different decision than another client. And we understand that that's the case. Our goal is just there to help provide you with the options and the information that you need so that you can feel like you're making an educated decision for your pet. You have to remember that when you come in to see us, you're now part of a team. That includes yourself, your veterinary oncologist, the veterinary technicians that work with oncologists, and also with the client care team. If you have any questions, we always recommend that you contact us. There's no question that's too small or too silly for us to answer. We're always happy to go back over information for clients because it's a lot to take in, it's a lot to process, and we know that you're making a big decision. Your oncologist may not be in the hospital all the time, but there are people that are there to help you. If you feel that your pet is having an urgent emergency, we recommend either contacting the main number for our hospital, your family veterinarian, as they can often help in these situations, or another local emergency clinic.